these spaces in person, especially after such a long pandemic. But I'm really great that we can host these educational events for everybody here today. We're so excited to have everyone, and the purpose of today's conference is to educate the community on oral health and local dental plans, which we believe are important steps to take in our community. Today we're going to be joined by Sorma, Dr. Mohanta, and Shahzad in an amazing presentation in hopes to not only educate, but motivate you guys to continue to make changes in your community. Common oral health problems can be prevented by proper brushing, flossing, and diet, but access to affordable dental plans leads to better health outcomes and a lifetime of healthy smiles. We hope that after today, this type of education can move you forward in your community, hopefully maybe through this pre-dental club, but also in your future endeavors as either dentists or leaders in the dental community. So I'm going to introduce who our team is today, and we're joined here today by Toronto Tooth, which is an amazing organization also at York University, and we're going to have them introduce their initiatives here today. And then I'll introduce our speakers, Sorma, Dr. Mohanta, and Shahzad, and we'll have our presentations and a Q&A at the end. So you can save your questions for the end of the presentations, and that way everybody's questions will be answered. And we'll probably have some questions on our YouTube Live as well, so we'll try to incorporate those in there as well. Who is Bright Future Dentists? We're a student-led pre-dental organization that is dedicated to helping students on their pathway to dentistry. Through guest speakers, workshops, and community outreach programs, we want to equip students with the knowledge and insight into the field of dentistry. Ultimately, we want to motivate you to be leaders in your community and push to change things in this pre-dental community. Our team helps in developing leadership skills in our members, but through that, we're creating that space for the pre-dental students to form friendships and network with each other. We also encourage everybody to join our WhatsApp group chats. That way you can directly interact with our executive members, and you can volunteer, you can get heads up on events, and so much more. So now I'm going to pass over the stage to Toronto Tooth, and they're going to be basically talking about how they have the importance of oral health and how they provide solutions for the community. We have collaborated with them today to provide dental care kits for shelters around York University and helping with this initiative. I want to welcome the Toronto Tooth team to the stand to explain more about their organization and what they do.
Hey everyone, my name is Heathy. I'm the social media manager of Toronto Tooth, and my role is to post encouragement posts to the different groups of Telegram channels because we want to work with different communities. And I want to tell Abby to introduce herself as well.
Thank you. My name is Abby. I've been a part of Toronto Tooth for 2 years, and I too am a social media manager. My platform is for Instagram, so all those posts and stories you see are done by me as well as my partner Ida.
I'm here to let you know a little bit about Toronto Tooth, and I'd like to start with telling the story of how Diana, the founder of Toronto Tooth, came with the idea of initiating Toronto Tooth. At the time, she was a project. At the time, she was cashier and you know then and after her night shift, sorry, I'm so sorry, she would see this man who was unfortunately going through unstable housing, and if she could afford it or she had time, she would buy him some food and have this short conversation with him. One night, he told her he really not planning to go back to the shelter anymore, and when she asked her why, he said that because the shelters not really take their needs to the consideration, and when she went home and she was brushing her teeth, she came with the question of how different shelter organizations might take the different needs of their residents into the consideration. And also then she started question how might these residents who are going through unstable housing will brush their teeth, or how they access their oral products. And it led down incredible path of research for her, which helped her to realize how these population are in need with the dental health care. As you might know, Canadian healthcare doesn't cover oral healthcare at this right now, and this has really led to oral health having a largest area in inequality compared to all other areas of health. This can really lead into problematic cycle, particularly as 1 out of 3 adults have recorded that they have experiencing of not being successful at job interview because of their appearance of mouth and teeth, which means that individuals are not able to find sustainable job, which further exacerbates on issue to have unstable housing because of their oral hygiene. At the time, it was also the beginning of COVID-19 pandemic, and lots of shelters were really focusing on purchasing sanitary products like masks and cleaning supplements. This left lots of gaps for lots of their products that are needed, including oral hygiene products. And we are really trying to fill this gap by creating the Toronto Tooth Project, which is an agent of change project in York University that has provided us with some funding to purchase and collect hygiene products, including toothbrush, toothpaste, and dental floss, mouthwashes, as well as a variety of other similar oral hygienes. Oral hygiene products that are all stored with storage bags that we also give at a variety of different shelters in Toronto. I want to let Abby to take over.
Thank you. Before I start, I do want to say thank you, Sarah, because this is one of her first presentations with Toronto Tooth. And so she did explain how we started at Toronto Tooth and how we evolved. So I'm just going to take over from here. Just to explain how what our target populations is, how we collect donations, and so forth. So at Toronto Tooth, we try and work through collecting donations from dental offices and larger hygiene corporations such as Crest and Colgate, who've been very kind to us over the past few years. And we've actually collected donations from individual donors, communities, and businesses. We've been so privileged with connecting with dental care owners and communities who have gone house to house and helped raise awareness to our cause and our mission. And with the products that we do provide to individuals, we provide all of these products to individuals experiencing homelessness and going through periods of unstable housing. In particular, we do try and focus on particular populations, and these do include women who have been experiencing trauma, including violence, females with or without children, as well as children and youth who may be on their own and experiencing legal or social issues. Unfortunately, we do also target children and youth who may have unfortunately experienced human trafficking in the past, as well as we are trying to try to include and not exclude. So we do also target non-residents of shelters who are individuals who are going through unstable housing and who are choosing not to reside in homeless shelters. And we have been so lucky to have a dedicated team of passionate students who have been passionate to work with us and provide wonderful products to wonderful people over the past few years. In fact, we were able to provide provide over 15,000 products so far in our project, and that means 15,000 smiles across the city. You can see all the products that we have provided within the city over the past 2 years, and I do want to say that this year we were able to reach our 15,000 mark. So thank you to all those individuals who did help us reach that goal. And we are hoping to move forward to provide these products to a larger population, which includes refugees, particularly because of some of the changes that are happening in the world. And we feel that this could be helpful to address some of the populations moving forward with our organization. Also, we do provide some dental care, mainly in the form of connecting various dentists who have been very kind to offer their services for free. So we connect these dentists and professionals with shelters and specific individuals. And we do provide these products to, right at the moment, 6 shelters within Toronto, and we are hoping to grow this list and add more shelters through to spread awareness about our organization and to help a variety of different individuals within our target population. And if anyone does want to pick up any one of these products, they can visit any one of these shelters to receive products completely free of charge. And we do also provide these products across York University campuses, as long as we are emailed beforehand, just so we know when to prepare your products for you. And you can definitely let us know if you do need any alternative pickup locations. We are accommodating, and I just want to say thank you for your attention and encourage you to visit our website and keep in touch with us through email and any one of our social media platforms. And thank you.
I wanted to give a huge thank you to Abby and Sarah. I really appreciate Toronto Tooth taking the time to collaborate with us. They have been so patient as we try to figure out the best way to move forward with this type of collaboration. I know that dentistry is something that's not necessarily a new field, but something that I'm noticing community involvement is kind of a new change that we want to do. And there's so many amazing ways that we can improve that moving forward, and Toronto Tooth is an organization that's been really moving wonders through that. So I wanted to give a huge round of applause again to them for that. I wanted to present our speakers here today, who they are, what their backgrounds are, and exactly why they're here today to present to you guys. I'm going to start with Dr. Sanjukta Mohanta. She's a general dentist caring for children and seniors in governmental dental programs at a community healthcare center in Brampton. She has graduated from the University of Toronto, the Faculty of Dentistry, in 1999, and has always focused her career on community service and helping the dental profession. Her articles appear in various publications, and she speaks all over Canada, volunteers, and is on the board of Filling the Gap Dental Outreach. She was a past president of the Canadian Dental Association and founded the New Dentist Study Club. She enjoys improving oral health through presentations, advocacy, and organizing free dental days. Oh no, Sorma's picture is not there. But she's right there. Sorma and Shahzad are a dynamic duo working together to raise awareness about the proper dental hygiene. Sorma is the founder and president of Bright Future Dentists and has a passion for giving back to the community. Shahzad, with years of experience working in a dental office, recognizes the importance of preventative dental care and its benefits. However, she also sees that the public often does not understand the significance of preventative care. Together, Sorma and Shahzad have organized this conference to educate the community and break down barriers to information about oral health. Sorma is presenting on good practices for maintaining a healthy oral cavity, while Shahzad is bringing her expertise to the table to discuss the benefits of preventative care. Their goal is to empower individuals to take control of their dental health and live their best lives. I'm really excited to be here as one of the founders and vice presidents of Bright Future Dentists. Ultimately, we wanted to be a very multifaceted community organization that helps in multiple different ways. And I'm really, really proud of Shahzad and Sorma for putting this together. And it's really, honestly, so supportive of everyone being here today. I'm going to move the stage over to Dr. Sanjukta Mohanta, and she's going to take over and talk about dental plans and services. So give her a round of applause, please.
Thank you. Thanks so much for coming out on a Saturday afternoon, and welcome future dentists. I was actually so touched listening to the presentation from Toronto Tooth and seeing what Bright Future has done, because it just makes me feel like, wow, the future of the profession is like so bright, because like you're already community minded. So thank you very much for that kind introduction and for welcoming me here to this presentation, because I'm going to talk about public dental plans. I'm going to talk about my career in public dentistry, and also talk to you about my path in dentistry. Thank you. So, what got me interested in community service? Well, when I was in dental school, there was something that really impactful happened, and that was, I read in the newspaper that a young man my age died from a toothache. And it was on the front page of the Toronto Star. And I thought, how can someone die from a toothache? And when I read the article, it said that he was a young man, he went into the ER, he had trouble breathing, and instead of them giving him help, giving him medical help, the security guards actually restrained him because he was being belligerent because he couldn't breathe. And then when I read on further, I found out the man was black. And then I thought, was he being treated like that because of the color of his skin? Would someone who was white and in that predicament be treated the same way? And so I was reading on, and not only did the article talk about the fact that people can die from a toothache, but there was also oral health inequities. People weren't being treated the same way. And I thought, how is it that someone my age can die from a toothache? Why is it that someone my age can't afford to go to the dentist? Why is it that someone just like me doesn't have dental benefits? Why is it that someone just like me has a tooth that hurts so much that he ends up in the emergency room? And I thought, why is it that someone who has dark skin like me is dying in the ER instead of being helped? And that's when I thought, like, wow, there's so much more to dentistry than just taking care of teeth. We have to take care of the people and the problems and the access to care. We have to think about that as well. Because I grew up, I always had dental benefits. I never thought about the cost of dental care. And because I went in regularly, I never had a toothache. I had the luxury of braces, going in for cleanings every 6 months, getting my wisdom teeth taken out, and never having to worry about money. But there's so many people who do. And so that's why we need public dental programs. And then that's how I got into public health dentistry. So I got into advocacy. So when Jagmeet Singh was a provincial politician, he was my MPP. So I used to go to his office in Brampton. That's where I practiced. I used to go like several times a year and talk about the fact that we need public dental programs for adults. There's a program for children, there's one for seniors, there isn't anything for adults. And we even had a petition. So we went to his office, gave him a petition, said, look, all these adults need public dental programs. Look at all their signatures. And I used to visit him at Queen's Park as well. And he even came to my office and sat in my dental chair. And so I went to him so many times that he was so sick of me coming in. And he's like, I know what you're going to talk about. Like, you need dental programs. And I felt like he doesn't care. He just doesn't get it. But then when he became federal leader of the NDP, what's the first thing he talked about was dental care. And now we actually have a federal dental care program. So it just shows like talking to your politicians, talking to anyone, getting petitions, raising awareness, and eventually it pays off. So what we're going to learn today, we're going to learn about the federal dental programs, provincial programs, local programs, and also other ways that we can help patients who have access to dental care problems when it's related to financial need. And that's that's how you can contact me. That's my email address. If you're applying to dental school and if you want me to look over your application, if you get an interview and want to do some mock interviews with me, just contact me. I'll be happy to help. So about me, I grew up in Renton. I went to Turner Fenton High School. I went to the University of Waterloo and I have a Bachelor of Science degree in biology. And then I went to Toronto for dental school. So at first, I wasn't happy in my career and I was working in private practice, but then once I got into public dentistry, that's when I was like, wow, this is what I was meant to do. So I went from like wanting to quit dentistry to not even thinking about anything else. Okay, so my dental journey. So there's a really cute picture of me when I was 7 years old. I was in the cavity-free club. I was one of those kids that was excited to go to the dentist. But I never really thought about being a dentist. When growing up, I actually just wanted to be a mom. And I do have 2 kids, so that I was able to fulfill that goal. And then in grade 10, I did a science fair project called Open Wide, where I was actually trying to figure out which toothpaste is the best. So what I did was I tested Colgate, Crest, and Aquafresh. And the growth medium were slices of potato. And the place where I kept them was in the bathroom, so a moist environment. So what I did was I split the mouth into quadrants, like 4 sections. And what I did is after I ate some crackers, I would brush one side with Colgate, one side with Crest, one with Aquafresh, one would be the control. So after I brush, I'd use a Q-tip, scrape the plaque off my teeth and grow them on the potato slabs. And then I figured out which potato slice had the most bacterial growth, and then that would be the worst toothpaste. So from this experiment, I figured out that Colgate was the best toothpaste. So I guess that was my first thought of becoming a dentist. So I won an award for that science project, and I thought, oh, dentistry, that's kind of cool. But then I got my wisdom teeth taken out. And I got them taken out when I was awake. And I had a dentist who just put everything on your bib. So all the bloody gauze, all the pieces of broken teeth, it was all here. I felt all the pressure because I was awake, I wasn't put asleep, and I thought, this is barbaric. There's no way I want to be a dentist. So then during my undergrad, I thought, I'm going to be an academic, go back to doing research. So that's what I geared my undergrad towards. I was a teaching assistant, I'm teaching cell biology and genetics. I did a research project, but it was during that research project when I realized I hate research. And that was in my 4th year. So it was actually in my 4th year, it was around October, that I realized I have to do something else. Because my research project was on crickets. So I had to go into a room full of bugs. They weren't just crickets or all the different bugs that people are doing research on. And I had to go into this big tank and grab the crickets I was going to do my research on. And of course the crickets are jumping out, they're going in my hair. So I'd go in and tape my sleeves, tape my pants, close my mouth, trap my hair back, and grab my crickets. There were bugs everywhere. It was like Indiana Jones when he puts his hand in and all the bugs. And I thought, there was no way I could do this. So it was actually the crickets that made me think of teeth. So I went into my guidance counselor at school and I said, I have a science degree, I don't want to do research. Is there anything else I can do with this degree? And back then they had a filing cabinet. She opened up a filing cabinet. She's like, well, the only thing in here is a DAT application. I didn't even know what that was. She's like, oh, it's to apply to dental school, and she reads it, she's like, oh, you have to apply by the end of this week if you want to write the DAT and get into dental school next year. And I'm like, okay, I'll do it. And back then everything was by mail. So I had to write the application, send it by mail. The DAT was the next month. So I only spent 12 hours preparing for the DAT, and I aced it the first time. I had all the prerequisite courses to get into dental school. I applied to 2 dental schools, Toronto and Western, and I got into both. And I thought, dentistry is meant to be. But then when I got into dental school, I hated it. It just didn't feel right. I didn't like any of the courses. I didn't like the focus on money. All of my classmates were talking about what type of car they're gonna get when they graduate patient focused. They weren't talking about things like community service or oral health inequalities. And I was the type of girl in high school, I wrote letters to get Nelson Mandela free from prison. Like those were the things I was interested in, not, you know, occlusion and tea. So it just didn't feel right until I got into public health. So there's my undergrad circuits to tea. That's me in dental school. We actually had to do full braces from beginning to end, you know, on 2 kids. So she was a girl that I did a headgear for, if anyone has seen those. And then during dental school, I got accepted into a program to go to Northern Ontario for 2 weeks and work in a moose factory in a First Nations community, and I loved it. And I thought, when my youngest child becomes 18, I'm going to go back to Northern Ontario. And my daughter, who's my youngest, is 18. And in November, I went back. And so there's my daughter. She's 18, first year university, and she's studying business, and she wants to be a hairstylist. And my son AJ, he's now 20. He's a third year at Waterloo, studying business and math. And my husband's in business, and that's my dog Dude. So during the pandemic, we did oral health presentations, and she's a girl dog named Dude, so she helped me during the online presentations. And that's my other family. My other family is my dental family. So I work in Brampton at a government clinic. So we see children on Healthy Smiles Ontario and seniors on the Ontario Seniors Dental Care Program. And I absolutely love my job every single day. As soon as I pull into the parking lot, I'm like, I'm so lucky. I actually walk down the halls and think that I'm the luckiest person in the world. That's how much I love it. And as it was noted before, I'm involved with organized dentistry, and I was actually president of the Halton Peel Dental Association, but I am on the advocacy committee for the Canadian Dental Association. And my proudest accomplishment was delegating successfully to keep fluoride in the water in the region of Peel. Fluoride is a preventive agent, helps anyone regardless of income, so that was really important to keep fluoride in the water because fluoride prevents cavities. Okay, so I also go to Queen's Park every year with the Ontario Dental Association, and we advocate to improve public dental programs. This is really hard advocacy. We go every single year and talk about it, and there's very little change in the provincial dental programs, but at least we got a big win with the federal program. The other thing I do is I organize free dental days. So private dental offices that want to host a day, I organize the event, and what I do is I only promote it to places like food banks and shelters, so people in need will be the ones coming in. And we do cleanings, fillings, extractions, and then I invite volunteer dentists to help out. So we call them Smile Days. So I'm on the board of the dental charity Filling the Gap Dental Outreach. I actually was just there this morning volunteering at Rexdale Community Health Center, providing free dental care. And I was on the board for the Give from the Heart dental charity, where they have mobile units and they provide free dental care. Okay, so I told you that when my youngest would be 18, I'd go back to Northern Ontario, which I did. So I went to Big Trout Lake for 2 weeks in November, and we worked 12 days in a row. Every single day they were up there, and there's huge high need. And talking about oral health inequity, I was so surprised that in our own province, that people can have problems so severe with their teeth and no access. They live on an island of 1,000 people, and there's no dentist on that island. And they only have a dentist going up 4 times a year for 2 weeks at a time, so only 8 weeks a year. So of course, when I was up there, every single day I would just extract a permanent tooth on a child. That is so sad in our own province. But that's because they're not getting regular dental care, poor nutrition, food's very expensive up there, they don't have fresh food. It's a very dry environment, A lot of them are smoking, a lot of them don't brush their teeth, they don't have, there's very little hope. It was so sad. Like you ask the kids, what do you want to be when you grow up? And they kind of look at you like, what? Like a lot of them don't finish high school. High teenage pregnancy, high opioid addiction. It's a very sad environment. So if you have no hope for even like living the next day, you're not going to be brushing your teeth. There's also high suicide rate as well. So it was very sad to see all these problems there. I mean, the water's not even clean to drink. Like they don't even have the basics. So of course they're going to have problems with their teeth as well. So let's talk about access to oral health care. So which group do you think has the highest level of oral health problems? Yes.
The low socioeconomic.
Very good, yeah.
That don't have high-
Yeah, it's people with low income have the highest amount of problems with their teeth. And what increases your likelihood of going to the dentist? Yes?
Yeah, either you're getting a lot of toothache, or you get a higher income and you feel
Very
like that's
good,
it.
yeah.
You need to.
If you have dental problems like toothaches, you're gonna go. But actually, the number one reason for going to the dentist is you have dental benefits, either public or private. And it actually shows that it even trumps income. So people with the highest incomes, like the millionaires and billionaires, if they don't have dental benefits, they're less likely to go. So if you have dental benefits, you're more likely to go. So that means we should try to get everyone on a dental program, whether private or public. So for example, we can get everyone on a private dental program if we mandate that all employers have to make sure their employees have dental benefits, that's one. Or we can say that anyone who doesn't have private benefits qualifies for public if they have low income. Okay, what percentage of Canadians avoid going to the dentist because of cost?
Lots.
Yeah, 28%. And so 1 in 5 Canadians has a toothache and doesn't go to the dentist because they can't afford it. So like 20% of people in pain avoid going to the dentist because of toothache, because of the cost. So what are they doing? They're living with the pain, or they're going to emergency rooms and family doctors. And emergency rooms and family doctors do not do dental care. There aren't dentists there. There might be specialists there for trauma cases, but there isn't a general dentist there that's going to fill a broken tooth. So what do you think happens if you go to the ER with a toothache?
They'll laugh at you, probably.
Pardon me?
They'll laugh at you.
Yeah, what they'll do is they'll just say, oh, you're in pain, here's a prescription. Or you have swelling, here's an antibiotic. That's it. They're not treating the problem. And every time someone goes to the ER for a dental program, it costs our healthcare budget $500. Just think that $500 could have that person's tooth fixed. So it's really sad that people are living with pain or going to the wrong area for dental care. So like you said, people with the lower socioeconomic status have a poorest oral health, so that's the table on the right. And to show you the oral health inequities, like Indigenous people, Indigenous kids, 68 to 90% of them have tooth decay. Whereas actually the reverse in this area, like 68 to 90% of kids have no cavities at all. So like look at the difference there in the same province. Okay, so let's talk about government dental programs. So have you heard about the federal dental program? Right now there's an interim program called Canada Dental Benefits, or CDP. A lot of you are shaking yes. I just wanted to show you a video. That's okay, I can explain it. Will that be better? Okay. Oh, that's right. Okay, that's okay. Sorry about that. Can't see the video, but I will tell you about it because I know all about it. Okay, so the Canada Dental Benefit. So eventually the federal government wants to do a broad program that helps children, seniors, adults of low income. And that, the projected date for that is 2025. So until then, they have this interim program called the Canada Dental Benefit. So it's for kids under 12, and it's for kids of low income families. So the families have to make $90,000 or less. And what happens is the parents have to go online and apply through the CRA, the Canadian Revenue Agency portal. And if they qualify, then they'll automatically be sent a check for up to $650 that can be used for any dental services, even orthodontics. And so this is good for 2 terms, so between October of last year till July of this summer, and then another term. So that means the kids that are under 12 can actually get 2 $650 checks. That can pay for a lot of dental care. So if the family makes less, like it's between, so say the family is making $70,000, they'll get $260. So if you know families that don't have private dental benefits, the kids are under 12, please let them know about this program. So the money goes to the parents, and the parents go to the dental office, get the dental treatment done, and then they pay the dentist directly because they've already received the money from the federal government. So here is the website to apply. You can, if you don't remember this, you can easily just Google Canada Dental Benefit, and it'll come up. Here's some other federal dental programs. So for Indigenous, they have NIHB, non-insured health benefits, which sounds great that all Indigenous communities have coverage. However, is there a dentist in those communities? No. Like they're reliant on dentists from the south being flown north for these 2-week contracts, and then they fly back again. So there isn't even ongoing care. But non-insured health benefits can even be accessed here. So there are Indigenous people, you know, in Southern Ontario, live in the cities, who have dental offices right across the street. They can use this program. So at least, you know, people who have access to dentists can use this program. And it covers basic dental services, plus it can even cover braces in some situations. So it's a great program. Yeah.
You mentioned braces for the last
Yes.
Canadian. Knowing the cost of braces, like 2 $650 checks.
Yeah.
How much?
Yeah, it's true. Like an average cost for orthodontics is $7,000. Right now, the Canada Dental Benefit's only $650, so it's not going to cover a lot. But say the child needs to get teeth extracted for braces, they can use it towards that. Every little bit helps, though. Another program is the Interim Federal Health Program for refugees. This is only for emergencies. So the Ukrainians who came here recently, they aren't considered refugees, they're considered displaced Ukrainians. So unfortunately, they don't qualify for this program. So the term refugee, there's like a certain definition for that. And then Veterans Affairs, Canada is for, you know, military personnel. Okay, provincial dental programs, there's one for kids, so that's the group that I see, Healthy Smiles Ontario. So this is a program for kids under 18. It covers comprehensive care like extractions, fillings, cleanings, exams, x-rays. It doesn't cover cosmetics, and it doesn't cover braces. And when a child is on this program, they can go to any dental office, public or private, and get the dental care. And it lasts for a year, and as long as the income is low, it'll get renewed again for another year. But unfortunately, the income requirement's really low. Like, guess how, say it's a couple with 1 child. Guess how low their income has to be in order to qualify for Healthy Smiles Ontario? $25,000 a year. So just think, like if they make $1 more, they don't qualify. It's like this online application, and like the computer automatically disqualifies you if you're over that limit. So it's so low. So there are a lot of low-income kids who aren't getting dental care because their family can't afford it. And there's also the Ontario Seniors Dental Care Program. So it's for seniors 65 and older living in Ontario. Again, very low cutoff. Ontario Disability Program for adults with disabilities, but very basic care. And Ontario Works for people who are unemployed but looking for work. Again, very basic care. The biggest problem with all of these provincial dental programs is that there's a really low reimbursement rate for dentists. Like the government only gives them 37% of the full fee, which means the dentists actually have to pay out of pocket to see these patients because the cost doesn't even cover expenses. So a lot of dental offices don't accept any of these provincial dental programs. So even though people are on public dental programs, there's nowhere for them to get their care. So I'll go into these a little bit more. So Healthy Smells Ontario, there is, so I told you how the family income has to be really low to qualify. There is another program called Healthy Smells Ontario Emergency Program. So if the child has an emergency, like a cavity, pain, infection, they can go to a public or private dental office. The parents can say, I have financial hardship, and then we'll say, okay, your child has an emergency. It doesn't matter what your income is, whether it's $25,000, $30,000, as long as you say it's a financial hardship, we're gonna put them on the program and it lasts for 12 months. So if you come across any children who have, an emergency and the parents are concerned about paying for dental care, just say, oh, go to your public health department and get screened for the emergency program with Healthy Smiles Ontario. So this is more, the emergency program is more needs-based rather than financial-based. Okay, Ontario Seniors Dental Care Program, again, the income is really low to qualify. So a single under 22,000, a couple under 37,200. It does cover dentures, it does cover crowns and root canals, so very comprehensive care. However, here's a big problem with the program. They can only get care at a public dental clinic. Sounds great, but there are hardly any public dental clinics around. Like in all of Toronto, you might think, oh, there are 25 dental clinics. So yeah, but there are thousands and thousands of seniors who qualify for this program. So I work in Brampton, that's a region of Peel. We only have 3 government clinics. I work at one of them. And there are 8,000 dentists, 8,000 seniors on the waiting list to get dental care. So by the time we call them and say, hey, it's your turn, their child is picking up the phone and saying, my dad just died. So I mean, they're like dying waiting to get on the program. So it sounds great that there are all these public dental programs, but there are so many problems with all of them. Ontario Disability Support Program. Again, a lot of dentists don't accept the program because the reimbursement rate is really low. And also there are high needs. And so a lot of dentists are thinking, why should we accept these programs? Because it takes twice as long to do the treatment, and then we're not getting the full fee. Ontario Works, it's really hard to find a dentist to accept this program because the fee is so low. You'd be surprised to find out about it and how much administrative work is involved in getting reimbursed for this. So unfortunately, adults on these programs, are having a hard time getting dental care. Now the York Dental Student Program. Did you know that there is a York Student Dental Program? A lot of students don't know. So you're actually, if you're full-time, you're automatically enrolled in it. Say you have private dental benefits for your parents and you don't want to pay the extra fees to have this program, you can opt out, but you have to opt out within the first month of each semester. The other thing is, say you don't automatically get enrolled in the program, you can opt in. And if you have spouses or children, you can add them to the program as well, but that means you have to pay a little bit more. So does anyone know how much the program covers? What's the maximum amount?
600.
600, good. And what is the deductible? Like how much do you have to pay yourself? 25%, very good. Yeah, so what do you think you can get with $600? At least once a year you can use it
Just
to get
a feeling.
scan, x-rays, cleaning. The good thing is there are, dental clinics like this one called Dentistry at St. George. It's at the St. George campus of University of Toronto, so downtown. And I give this offer to U of T students as well, where they give you a discount. So for example, on cleanings, they actually don't charge you the 25% copayment. And then for like fillings, extractions, they they give you 20% off. So you're only paying like $10 or $20 out of your pocket for a filling if you use your plan. So it doesn't cover a lot, but it's, every little bit helps. And if you want to find out more about what procedures are covered or not, you go on the website and then there's a little box that says like My Benefit Booklet, and it tells you what's covered under dental care, vision care, physiotherapy, prescription drugs, all of that. Toronto Public Health, there are 25 Toronto Public Health clinics that have a dental suite in it. And so if you have, so for example, Toronto Tooth, I know that you're doing things like working with your clients to direct them to getting dental care. You can just, like here's a QR code that you can just Google Toronto Public Health clinics, and it'll tell you that if you want to find out whether the person's eligible or not, they have to actually call each dental clinic to find one that may accept them. Because each one has different eligibility criteria, but each one accepts kids under Healthy Smiles Ontario and seniors on the Ontario Senior Dental Care Program. For adults, it's really case by case and clinic by clinic. So dental services at a discount. So I just told you about all the dental programs, but what if you have a patient who doesn't qualify for any federal or provincial dental programs? That doesn't qualify for Toronto Public Health. Well, one of the things you can do is say you can go to a private dental office and ask for a discount or a payment plan. You can tell them to go to free dental days. You can direct them to where I was this morning. It's called Filling the Gap Dental Outreach. And so we have a location in Scarborough and Rexdale, and we provide free or discounted dental care. Or you can tell them to go to dental school, University of Toronto, George Brown, dental hygiene schools. The treatment there is very inexpensive. Now, Toronto has a list of low-cost dental clinics on their website. So if you do Toronto Public Health low-cost clinics, all these clinics will come up, and you can direct clients there. And now I'm going to hand it over to Sorge. So does anyone have any questions about public dental programs? Yes.
Does anything that like dentists do fall under medically necessary procedures?
Oh, okay, that's a very good question. Like whether it's covered by OHIP.
Yeah.
So the dental procedures that are covered under OHIP will be things like dental trauma. So say you're in a motorcycle accident and to get your jaw fixed, then that'll be covered. And the oral surgeon who's on duty at the hospital will do it.
So it has to be at the hospital? Like
Yeah, that's right. Yeah, and there are some other things like when someone's medically compromised, they will be able to go to the hospital and get their dental work done there because it's too risky for them to go to a regular dental office. Also, the hospitals for children in downtown Toronto, they have programs for kids. For example, if they're born with cleft lip or palate, that is covered under OHIP. If they have congenitally missing teeth, so they're born missing a lot of teeth or born with genetic diseases that affect their teeth, that'll also be covered. Special needs kids, it'll also be, they can also get their dental work at sick kids if they have to be put asleep. And the other thing is kids under 3 with severe dental disease, they can also go to sick kids. Kids who have dental trauma, so say they fell and their tooth came out, they can also go to sick kids. So it's very limited with what dental care is covered, with dental care covered under OHIP. Like even people with cancer, like to the head and neck area, who end up losing their teeth because of radiation, they end up, like there's very little coverage for them. And
what about the cancer patients who have to go under chemotherapy and have to like do all the fillings? If they
like they do have,
that
so
covered?
at Princess Margaret they do have a dental clinic, but again, they don't cover everything. So a lot of these patients have to pay out of their pocket. Yeah, it's really sad. It's not their fault they got cancer and now it's affecting their teeth and now they have to pay for that. Yeah.
Thank you.
Good question. Yes.
At your public health clinic, how many patients you see a day and how many dentists?
Okay, that's good. So in public health, at my clinic there are 5 dentists. We have a big clinic with like 8 to 10 operatories, and I work 4 days a week, and I see, most of my appointments are 1 hour, so I see like maybe 7 to 8 patients a day.
And most of your patients, I guess, are seniors.
Actually, they have kids dentists, HSO dentists, and the seniors dentist, so I'm a kids dentist, so the majority of my patients are kids. Any other questions? And I will be talking about my life in public health dentistry for the second part after Sormay's fantastic presentation. So take it away, Sormay.
Hello, you guys can hear me? Yeah. Hi everyone, my name is Sormay, and Shannon already introduced me a little bit, but I just want to introduce myself. Hi, I'm Sormay, and I am in my 4th year of biomedical sciences at York University. I'm another one of the founders of this club. I like to call myself Mrs. President, and you all should. So yeah, today me and Shahzad put together this presentation just to let everybody have some information about why you should be brushing your teeth, what have you been doing every night and why, and providing access to dental care, because I know while you know why you should be taking care of your mouth, maybe you don't have access to it or you don't have any real solutions. Yeah, so basically why I want to be a dentist, I'm just going to let you know, is because I think that this field is really amazing. I like the workplace, and from what I've seen shadowing, I really like that it's a really active workplace. You get to interact with patients, it's a more, what can I say, like a closer relationship, and you have to really make them feel comfortable in the office. And a lot of times I've seen that patients are really nervous to come to the dentist, so I want to be that dentist that is really awesome and hopefully makes them not scared of dentists anymore. But yeah, so today my presentation is called Brushing Up on Oral Hygiene, and I'm going to be talking to you about the importance of oral health, how your diet can affect your dental health, the dangers of tobacco, cannabis, and vapes on your oral cavity and what it can lead to, and how to take care of your mouth. But I'm not really going to go into that because I think we all know how to brush our teeth. But I'm going to get started on, so why do you guys think it's important to brush your teeth? What have you been doing all your life, and why are you doing it? So basically, it's really important to keep your mouth clean because there are so many bacteria. So there's 6 billion bacteria, 7 different species. Sorry, I know Dr. Sanj told me not to get into the science, but I'm a bit of a nerd for the science. So I'm going to try to explain a little bit of it because I think it's valuable knowledge to just have a perspective on how to look at your food and just generally what you do with your mouth. But yeah, so there's lots of bacteria. Some of them are really good for you and you want them there, but some of them are not so good and they're going to create cavities for you. They're going to make problems, gum disease, so much other stuff. So what the most common oral health problem is pain. And obviously you probably all had, I don't know, I don't want to assume, but I think everyone's had cavities. And it's really painful, it's really annoying. You're trying to eat your favorite food and it hurts and your head hurts and you can't sleep, you can't do anything. So it's obviously a really bad problem. And that most people that have lower income, as Dr. Shan just mentioned, don't really have access to this dental care. And they should be, everyone should be taking care of their mouth because this leads to a lot of problems further on in life. For example, the dental gum disease and cavities have been related to increased risk of stroke, Alzheimer's, dementia, heart, the coronary artery disease. A lot of the bacteria that are found in your plaque are actually also found in your brain once they do scans of your body when if you have Alzheimer's or something like that. And also, yeah, so it's just not good for you. You should brush your teeth. I'm gonna say that a lot throughout this presentation. Regular care is important to prevent these bigger problems. So what is one thing? So even if you don't like brushing your teeth, which I think you should be doing, I think everyone does that. I'm gonna come So there's certain foods and drinks that really contribute to your mental health. Also your mental health. But yeah, so there's certain foods that make your teeth more prone to getting cavities. There's different foods that are gonna help you maintain your like healthy gums, healthy teeth. So I'm gonna talk about those a little bit. So do you guys know candy's bad for your teeth? I think this is the first time all of us are hearing this. I think it's crazy, I never knew this. But why do you guys think that candy is bad for you? What are the main reasons that everyone says candy's bad for you? Anyone in the audience care to share?
The sugar, all the sugar.
Yeah, sugar, yes. Sugar is not good for your teeth. And what else? Why else is candy not good for you? Not a trick question. It's pretty obvious. Martha?
I guess some of them are sour candies. The acidity changes the.
Well, yeah. In general, the sugar in candy turns into acid. Like it makes the pH go lower and it makes their bacteria, like lives go, yay, like they're billionaires now, they have so much sugar to feed them. Go ahead, Nathan.
Some of them are sticky, so I guess if it sticks to your teeth, it stays there, and it's like if you don't brush, it'll just stay there.
Yeah, exactly. So one of the biggest problems is that candy gets stuck in your teeth. And so this is my handy dandy gummy bear. He's gonna be helping us understand why it's bad that the food gets stuck in your teeth. But anyways, so once you chew the gummy bear, obviously the gummy bear is gonna get stuck in your teeth. And your saliva turns this gummy bear in, like, digests it in your mouth. And this is like one of the ways that like food gets digested is through your saliva. So the sugar gets digested, or the candy gets digested into like simple sugars, and the bacteria that are like living around your gums, that are just like the bad bacteria, love to eat sugar. And once they eat it, they're gonna secrete acid that's gonna dissolve the enamel on your teeth and make it really easy for the bacteria to infect the area. And so obviously if it's stuck there, it's gonna continue to release sugar and feed these bacteria for like a long time. So it promotes the cavities and other problems. Whoa, I didn't know there was confetti. Anyways, did you know that fermentable carbohydrates, I'm gonna explain what that means, but did you know carbohydrates are also candy, but undercovered? They're very sticky like that. So when you eat a piece of bread or potatoes and things like that, these are all made of carbohydrates and starches, which are basically the same as sugar. They are sugar, basically. So when your saliva does the same deal, breaks the sugar down, and when you're eating these, they still get stuck in your teeth, and they still make the same problems happen. And so they're not good. And fermentable carbohydrates are the ones that this happens to them, like they break down in your mouth, but not all carbohydrates do. And later I'll talk about, I'm not going to talk about, but I'm going to suggest like these different carbohydrates. There's a link that has a suggested diet list, like for the carbohydrates and like which ones you should be eating, which ones you shouldn't be. But basically any like white bread or potatoes, anything that's like has those starches in it is gonna be really bad for your gums and teeth. So you should be eating more like whole food, like whole grains, or like whole wheat cereal, things like that. And they still taste pretty good. I don't know what the deal is about, like people not buying them. I still like them a lot. Another thing that no one knows about, or no one considers, because like, even me, I just eat dry fruits because I think, oh, that's so much better than candy. I'm gonna be skinny because I eat dry fruit. But they still get stuck in your teeth, and they're still gonna cause the same problems as candy. So I suggest flossing or brushing your teeth after you eat them. Other things that I think you've probably already heard about, but I'm just gonna tell you again. Pops and juices, they're not really good for your teeth because obviously pop especially is also acidic. It's not just sweet, it also is very acidic, and it's gonna, wash all the enamel off of you, make you get cavities. Coffee and tea, although they are one of my favorite beverages, they are not that great for your teeth. Although they're a bit better than, I guess, pop or juice, but just the fact that they have this what's it called, pigments in them, and they pigment your teeth, and also they're acidic, same thing, but they're not as acidic as pop or juice, so it's something. And cocktails as well. The thing about tea and cocktails is that usually when you're drinking them, you're acidic. So you're gonna be exposing your enamel to sugar and acid for like longer periods of time. So it's gonna be making you more prone to getting cavities. But for example, if you wanna like chug a pop or the coffee or something, then it's not gonna have that much contact overall, so you are better off that way. And the last thing I want to say is ice. I really like ice in all my drinks. I really like cold drinks, but this is really bad for making your teeth really sensitive because when you're chewing on ice, or I guess, I'm not sure if just generally cold drinks, but it causes cracks in your enamel, and this makes you more prone to like the bacteria getting into your teeth and like infecting, but also it just makes it really sensitive and painful all around. Just to make sure, I want to see if I mentioned everything. Oh yes, I will mention the rest later. But so now you're hungry, so what should you be eating? Like I'm just telling you, don't eat anything. But there are really good things that you should take note of. You should be eating unsweetened, I didn't even write sweetened, unsweetened, unprocessed, and unpackaged foods. So what I mean by these are just, obviously don't put extra sugar in something, don't eat things with additive sugar. Unprocessed, as in like packaged foods, obviously are processed foods. There's some different additives, like acidic things that want to preserve the food that are not going to be so beneficial to your overall health as well as your dental health. And unpackaged, same things, unprocessed. So there are some foods that like you should be specially eating. For example, apples, carrots, or just like raw fruit that you just like bite into. Those are really good for helping your gums to but like be stronger, because that you are like physically eating something like really hard. So it helps to like
Gums are working now.
yeah, they are working out. They stimulate the gum growth.
Oh,
There we go. And also when you're biting and chewing, especially for like but when you're biting and chewing, it really helps to like brush your teeth because it's like full of fiber and it's kind of like a natural toothbrush. I don't know if you've ever had like a pizza followed by an apple. I think maybe that's something only I do. But like I feel like my teeth are just like clean after, like it's like brush the plaque away. But still, you should brush your teeth after. Foods that have high fiber and water, they act like a natural toothbrush. They promote saliva production, and again with the heavy biting foods, they also help you produce more saliva. Saliva is really good. It helps neutralize your mouth. It helps take away the bad bacteria, so it's really good. And so these are just like some foods or vitamins, I guess I'm suggesting that you should keep in mind when you're eating food. Okay, I'm not good. So there's foods that have high vitamin C, like citrus fruits, but still try to not to like cut them into fours and eat them and put them on your teeth, because the acid is gonna be like rubbed on your teeth. That's not really good for you. You should try to eat it like peel it and take it piece by piece. The other vitamin C is really good for like helping your gums heal. These are all really good for helping your gums heal. Vitamin A, if you eat them alongside with like high biotin foods like eggs, and these help synthesizing keratin in your body, which also helps with gum healing. Have like meat and milk, like leafy greens. They have vitamin B12, vitamin D, and calcium, and you need vitamin D in order to absorb calcium, so you should be eating those together. And also there's folic acid in leafy greens, which is really good for your gum health, and omega-3 in like fish, nuts, things like that. And there's also like these other foods that I suggested, like yogurts have natural probiotics, and they have good bacteria that can populate your mouth, and they help just like have good bacteria along with bad bacteria in your mouth. Cheddar cheese, or other cheeses. This is something my dentist told me, because I always like eat a lot of vinegar and pickles, and that's still not good for your teeth because it has acid in it. So she said like at least eat it with cheese, because it neutralizes the acid that you're eating, and it's beneficial for your mouth because the plaque really likes the acidic environment. And green tea, and I just said don't drink tea, but like still, green tea is really good for you. Has antimicrobial agents, like limits bad bacteria. and it has natural fluoride. Although when I search it, it's not like significant, but I mean something to consider. And dark chocolate is really good for, again, like for your gum health and just your overall health. Has natural antioxidants in it, and try to eat the unsweet ones because sugar is not good for you. Okay, and now to cigarettes, vaping, and marijuana. So I think we all know, like, we've heard, don't smoke, smoke isn't bad for your teeth. But I just wanted to let you know that like all of these, like cigarettes, vaping, and marijuana, because a lot of people think vaping is not bad for your teeth, or it's better. But I still disagree. I think that they're all bad in the same way, because all vape, cigarettes, marijuana, all have the active ingredient of THC in them. And this ingredient is the agent that causes dry mouth. And when your mouth gets dry, your saliva is not cleaning up your mouth properly, and this causes gum irritation and helps bacteria grow, which leads to inflammation. And at the same time, like vapes and cigarettes have nicotine in them. Nicotine also makes your blood vessels really narrow, so you can't really have good blood flow, causes more problems again in the mouth. But I want to keep it brief, because I have like a whole research paper in here. If you guys have questions about it, I would love to talk about it, but let me know. But again, all these problems kind of lead back to each other. So if your mouth is dry, you can get irritated gums. And your irritated gums are obviously probably inflamed. Inflammation can cause your salivary glands to go crazy. You know, and because there's inflammation, it's easier for bacteria to infect your mouth and your bloodstream, cause problems. So this concludes my presentation, but I wanted to leave with the ending remark that you should, this is actually the tooth fairy. If you guys didn't know, this is what the tooth fairy looks like in my head. But so you guys should brush, floss, rinse, and repeat. So repeat after me. Brush, floss, rinse, repeat. There we go. Thank you guys for listening. And I will pass the presentation on again to Shahrazad, who's going to be talking about the importance of preventative dental care.
Okay. I don't know if I need to use the mic or not, because I have loud voice. Okay, thanks everyone for joining us today. Thanks to Dr. Sanj and Sorma for their incredible presentations. Thanks for coming. That means a lot. That means not only you care about us, but about your oral health. Okay. I'm also a pre-dental student, and I'm the event coordinator of this amazing team, Bright Future Dentist Club. And today I want to cover the topic of dental emergency cases, because during the past 16 months, I've been working as a 24-hour on-call receptionist at a dental office, and I'll take emergency calls, and I want to discuss with you what are the most common dental emergency cases. And then I'll share with you how to prevent spending so much money on emergency dental services and major treatments. Okay, one of the most common calls that I receive are about knocked out teeth, usually in children between 2 to 10 years old, but also adults. I remember last year I received a call from an adult man who told me while they were playing, one of his friends threw a hockey puck to his face and the whole tooth was knocked out. But again, it's rare because it's usually accidental while kids are playing or falling off somewhere. And it happened to myself when I was 8. I fell off my bike and my front tooth was chipped and knocked out. Not knocked out completely, broken in half. But again, it's something unpreventable. What you need to do depends on whether the tooth is permanent or primary. For primary teeth, there is no need to reimplant the tooth. Hopefully, a permanent, beautiful tooth will regroup for the kids. But what you need to do as their parents is to stay calm. Don't stress out because children children get traumatized easily. And yeah, but do your best to go to a dentist and visit a dentist and get their advice for your child. But for permanent teeth, story is different. You need to put it back immediately. There is a chance that the tooth can be placed back and reimplanted. That's why you need to go to a dentist like in a specific window of time. But unfortunately, these kind of emergencies happen out of business hours, during night, and we don't have emergency dental services in Canada. And I'm so sorry to say this. I hope this issue will resolve soon with the help of oral public health practitioners and through advocacy of the dentists we have. Okay, let's talk about the other most common emergency case, which is preventable, and that's infected tooth. This happened to adult patients. When I answer the call, they say they cannot sleep, they cannot drink anything, they are even crying. And what I ask them is that, when was the last time you visited your dentist? And guess what they say? They either don't remember or say 2 years ago, a few years ago. And that's too sad, because these types of dental emergencies are preventable. You need to visit your dentist regularly. Infection shows that there are so much cavities building up near your nerves. So if you had gone to your dentist earlier, they would probably detect the cavity and you wouldn't end up having that much pain. So they'll come to the office, dentist prescribe them antibiotics, and after a few days they'll come back. Usually they need root canals, or even if the tooth is untreatable, extraction and implants, which are costly, which are so expensive. So we don't want that to be happening to you, right? That's why I want to discuss why do we neglect to visit our dentists. Let me ask you a question. When was the last time you visited your dentist?
3 months ago.
2 years ago? Yesterday? Okay. I hope you go there and visit your dentist regularly, because I know we have busy lives, but lack of self-care is the most common reason I found that people don't go to their dentist and visit them regularly. But believe me, if you don't go there and spend 1 hour yearly, you'll end up going there every week in the near future, and you don't want that happening to you. In the near future, you have to deal with costly, major treatments, painful. So what's the solution? Going there at least annually, but ideally you should go there every 4 to 6 months. And also cleaning, which is so important, because they'll help removing the plaques and cavities near your gums and prevent so many cavities happening. Okay, so as I said, you need to go for dental checkups, x-rays, exams, and hygiene. The next reason that people neglect to visit their dentist, as we talked about it in detail, is money. You may not be under coverage of private insurances or even public insurance, but what you need to do is to save on yourself. Why not? If you allocate a budget for yourself, let's say $30 to $40 a month, at the end of the year you'll have enough money to go for a checkup and even getting your hygiene, your cleaning done. So my advice for you is to either buy a private dental insurance if you can afford it, because that gives you a peace of mind, and you end up going to your dentist and your hygienist even more frequently. So if you cannot do that, that's fine. You need to save your money yourself, or as Dr. Sam said, Dentistries at universities are a better option. They are less expensive. And if you go to a dentist regularly, I promise you that they see you as a loyal patient, and they'll provide you with payment plans and even better discounts. So this is what I found very interesting. Teeth don't die a natural death, and you kill them. So you want to take good care of your teeth. And let's say if you don't go to your dentist and don't visit your dentist regularly, you'll end up going there every week, and you don't want that to happen. And that's my advice for all of you here. Thank you again for listening to me. I'll pass it to Dr. Sanj to cover the rest of her presentation.
Thank you. Those were two great presentations. And Sormay mentioned, avoiding like sugary stuff, acidic stuff. We had the joy of having coffee and cake before this presentation. So I just wanted to let you know that you can have your cake and not get cavities too. And that is, you do harm reduction. So, Sormay was talking about things like eating cheese, carrots, apples after. So you can have your cake and have those things after, rinse your mouth after, that cleans your teeth. You also have to think about frequency and duration. So for example, if you want a can of pop, you can have it, just gulp it down in 5 minutes, so then the sugar's only on your teeth for 5 minutes, instead of sipping on it for an hour. Same thing like with a bowl of grapes. You might think, oh, that's healthy. But if it takes you an hour to finish those grapes while you're studying, then the sugar's on your teeth for an hour. So just have it fast. And also things like your water, make sure you don't add anything to it. Like, how they have things like flavoring that you can add to it, well, that has acid. If you add like lemons and strawberries to it, that has sugar and acid. Especially if you're sipping on all day, that's going to be detrimental for your teeth. And water is the best drink for your teeth, so drink it often. It helps rinse your mouth. And so if you don't have water available, if you don't have cheese and carrots, you can also use sugar-free gum, and that'll stimulate your saliva and help wash away the food that's stuck to your teeth. But like she said, the best thing is to avoid those foods, but it's really hard to do. Because I have a sweet tooth as well. So now we're going to talk about our career in public health dentistry. So I told you that I wasn't happy like as a private dentist. So what changed my mind? Why did I go from private to public? Well, it was because of a 4-year-old. That 4-year-old was my son. So I wasn't happy being a dentist. I used to leave my kids and go to work. And I guess they could tell that I was unhappy because one day my son said, "Mommy, why are you going to work?" And I said, "To make money." And he goes, "Is money more important than us?" And I went, "Oh." And I thought, good point, because my kids were 3 and 4 at that time. And I thought, if I'm leaving them, I'm their only mother, then I have to leave them for someone that needs me more than they do. So the people who need me the most are the people who can't go to a regular dentist. The people of low income, the people who go to public health clinics. And I remember the best moment in dental school was, doing the rotations at the public health clinics, because that's when you can make the most impact. Doing like public health presentations, like they would really listen and they would say things like, okay, I'm going to stop doing this, I'm going to start doing that. They really wanted to improve their lives and improve the lives of their children. And also, like, I was often the first dentist they ever saw. They were scared, so like you, I thought, I want to make a good impression, so they feel comfortable going to the dentist. So I thought, like, wow, you can make the biggest impact in public health. So the day after my son said that, I went to the journal, like the dental journals, the classified section at the back, and there was an ad for a dentist to work at a public health clinic, and I applied, and I got in. So it's like one of those things where, like dental school, public health, I just applied and got in because it was like it was like the universe was listening to me. So I have him to thank for it because I've been happy doing that ever since. I also go to schools and do public, do oral health presentations, so that's a lot of fun. And I see that a lot of you are doing that as well, so keep that up. So there are 5 reasons why someone can have trouble accessing oral health. It's not just oral health care, it's not just finances. So finances would be like affordability. There's also accessibility. Like say someone, is working, during the times that most dental offices are open, then they can't go to the dentist. So that's an accessibility. And what if someone has a wheelchair or has to bring their kids or has a cane or then there's steps? So you have to think about that as well. Sometimes they can't even physically get to the office. The office isn't open when they're available. They don't have childcare to go to the office. Sometimes they don't feel welcome. So for example, someone who's trans can go to a dental office and then the first thing they're told to do is fill out this questionnaire. And it's like, well, what gender are you? And then all of a sudden they're like, well, they don't feel like they're accepted. Or what if you don't speak the language? And so there's so many reasons why someone may not go to the dentist, and it's not just about money. So be mindful of that. Okay, there are also social determinants of health. And this is actually more important than like the brushing and the flossing. It's actually, what are all the things that impact your health? Not just oral health, but overall health. Well, it's actually been shown that people who don't have, a safe community, who don't have access to food, who don't have safe housing, like who don't have high education, that all affects their health. So when someone has problems with food security, housing security, just feeling safe, like all of those things, if they have all those other issues, they're not gonna have good health and they're not gonna have good oral health. So actually you can make a big impact, not just doing dental care, not just teaching someone how to brush and floss, but doing things to improve these problems. Like for example, doing food drives, advocating to politicians that we need to increase the minimum wage, we need to keep the cost of basic food necessities low, we need to tax bad food and give a discount on healthy food, things like that. So just like I said, going up to the First Nations community, well, why do they have worse health care even though they're in the same province as us? Well, they don't have access to clean water. They don't have fresh food. There are not a lot of opportunities for them. So of course that's going to affect their health. And this is what I found is really interesting in what has the most impact on your health. And so you might think, okay, teaching someone prevention has the most impact. It actually has the least. So prevention, like daily prevention at home, actually is at the top of the pyramid. What's on the bottom that makes the biggest impact are things like public dental programs, private dental programs. So actually things that are more society-based, that affects everyone, makes the biggest impact. So when we come to dentistry, socioeconomic factors, that'd be like you're having public dental programs. The bluish, the teal, individuals' default decisions. This would be like community water fluoridation. So they turn on the tap and they are getting fluoride. They don't even know it. Like you're building it into their system where they don't have to make a decision. So long-lasting protection, purple, that would be doing dental sealing, so covering the tooth before it gets cavities, or doing fluoride varnish in the office, in the dental office. So those will cause, and people using fluoride toothpaste at home, fluoride rinses, those would be in the purple. Green, clinical interventions, that's the dentist or hygienist actually doing the dental treatment. And then the red, those are things that people are doing at home, like the brushing, flossing, eating healthy food. So we can make the biggest impact by advocating for improvements in public dental programs. Okay, so what is public health? Well, really it's just the art and science of preventing disease. So that's the World Health Organization. And just so you know, the World Health Organization listed community water fluoridation as one of the top 10 oral health, like not just oral health, but health prevention strategies. So there are different specialties in dentistry, like you can specialize and become an endodontist and just do root canals. You can just do extractions, like an oral surgeon. You can just see kids and be a pediatric dentist. Or you can specialize in public health. So University of Toronto has a public health program. That's one of the clinics there at University of Toronto. And so the University of Toronto has all the specialties, so you can specialize in any dental specialty there. And it has one of the few public health specialties in Canada. So what they do is they focus more on the research, on policies, on population, like the data, so they can see like which groups are vulnerable groups, so they can know like where we should focus our attention. They will do things like the community water fluoridation and the fluoride varnish programs and the sealant programs. Okay, so if you become a public health dentist, like a specialist, what can you do? Well, actually very few public health specialists do dentistry. So I'm a general dentist and I work in a public health clinic, but I'm not a public health dentist in the fact that I don't have my specialty. So specialty, you'll get your master's program. It's usually a 2 or 3 year program. You can even do your PhD in public health. So why is it that these people have all these years of schooling, but they're not actually fixing teeth? And it's because they're actually thinking more on the population, about the population rather than individuals. So they're doing things like research, writing articles, teaching. They're involved with the government in making policies. So for example, the government is using public health dentists and asking them questions like, what dental services should we cover under this new plan? So they're the ones doing research to figure that out. Or which group should we focus it on? So they look at all the data and say, okay, you need to focus on First Nations, children, seniors of low income, things like that. Is anyone here interested in public health as a specialty? Really? Oh, that's fantastic. Oh, good. A couple of you. Okay, so here, I used to work in private practice. So I worked in private practice for 7 to 8 years, but I've been working in public health ever since. What's the difference? Well, the first thing is the patients you see. So it's not just the fact that, okay, you're going to see low income versus higher income, their needs are going to be different. For example, I told you how I went to the First Nations community, high needs. So, almost every single person has a caveat in every single tooth. So it's higher needs that way. Also higher needs in that they haven't been treated well, they don't have a lot of support. You also have to help them in other ways too, like asking them, do you have access to food? Do you have, a safe home to live in? So we're also, not only are we doing things like encouraging them to brush their teeth, but we're encouraging them to, have, to pursue education. We ask them about jobs. We ask them about, do you feel safe with your partner? Things like that. So we're looking at them as a whole person, not just their teeth. The procedures are different because if you're seeing patients who are on public dental programs, it only covers basic services. So you're just doing things like fillings, extractions, cleanings, exams. You're not going to be doing things like dental implants, cosmetics, braces, because it's not covered under those programs. So that's one of the drawbacks to working in public health, is I'm not doing those cool Instagram cases that you're seeing. It's basic dentistry. The goals. So in private practice, the goal is profit, and it makes sense. It's a small business, it has to be profitable. And there's nothing wrong with making a profit, because it's good if you're a successful business, because then you can provide more to your patients. You can have better materials, you can pay the staff more, so you can have the best staff, you can have better equipment, a nicer environment, you can pay for continuing education to advance your skills, so it's actually a good thing to make a profit. The goal in public dentistry is actually prevention. So we really focus that first appointment on what we heard previously about prevention, diet counseling, and good home care, and having responsibility for the oral health. So they're just not coming in for the emergency appointment, they're coming in for regular care. Flexibility, like if you work in a private office, you have more flexibility on when you can take time off, when you can start, when you can leave, and public health, it's very regimented. Here are your hours. You have fixed vacation days. So it's inflexible that way. The flexibility also, like if I go to a course and I'm like, wow, that was a great new product, I want to use it in my office. Well, I can't because there's a fixed budget. So we just can't buy it. So I have to wait until there's room in the budget or buy it myself if I want to use it at the office. For in private practice, you know, they could be like, sure, you want to use that product? Go ahead. So flexibility that way. And income. So if you work in private practice, you'll make twice as much as if you worked in public practice. So it was good that I worked in private practice at the beginning because I was able to pay off my student loans really quickly. And then I went into public health. And for me, like, wealth is not one of my values. So it doesn't matter to me if I don't have a fancy car or, you know, a huge home. But, you know, I was so thankful to, you know, be able to spend time with my kids and volunteer at their school for 10 years. You know, I went a half-day week every single week for 10 years to help them. And it was more important that, you know, I didn't feel any guilt leaving them at home when I did go to work. And I felt so satisfied helping the people who needed it the most. So because I was following my purpose, my kids were happier as well. Okay, my typical day. So I work Monday to Thursday. 3 of those days I work 8 to 4, and one of those days I work 12 to 8. So we do have evening and Saturday clinics as well. I only have to work 4 Saturdays a year, which is pretty good. So most of my appointments are 1 hour. I work with a dental assistant. So what I'm mostly doing in that 1 hour is, say, for example, usually kids have cavities everywhere. So I'll work in one corner of their mouth and I'll do a sealant on their permanent tooth. And then they have those 2 baby molars in front. They usually have cavities, so I'll fix those 2 cavities and do a sealant all at the same time. So I'm working on like 2 or 3 teeth at a time. Extractions, we'll do that in about a half an hour. We do cleanings, exams. We do a lot of prevention. So there's this new product called silver diamine fluoride that you paint on a tooth and it stops a cavity from progressing. So we'll do that as well. And a lot of time just talking about things like motivating them to brush, talking about their diet, and doing something called harm reduction, which is what I talked about before. Like, okay, if you're gonna drink that pop, gulp it down. And I am a big advocate for parents coming into the operatory, whereas if the whole family wants to come in and watch, that's great. I believe in patient-centered care and making the kids feel comfortable. So even when I see seniors, if the kids and grandkids want to come, spouses want to come, I invite them in. So it's a very like welcoming environment. We actually call our waiting room a welcome room and not a waiting room. And you can see like our mission, vision, values on the wall. So our vision, our mission at our clinic is to create a healthier community where everyone belongs. So it's not to be the best dental office in Brampton. It's actually, we want our patients to become healthier, not just with their oral health, but in every aspect. Okay, so public health clinics, there are not a lot of public health clinics, and most of these clinics do have general dentists working in them, not public health specialists, and we're doing general dentistry, and most of these clinics get funding through the provincial government for programs like Healthy Smells Ontario and the Ontario Seniors Dental Program. So most of them are like mine, where we see kids and seniors. So I get a salary, I get benefits, I get pensions, vacation days. So a lot of perks that way. Whereas if you work in private practice, you don't get maternity leave, you don't get sick days. If a patient cancels, you're not getting paid. So when you work in private practice as an associate, what happens is you get a percentage of collections. So if the patient doesn't pay, you get 0. So you have to make sure that the patient's aware of the fee, that they pay. If the patient cancels, you get no money at all for that. If you're a private practice owner, it really hurts because you're still paying the rest of the staff and the patient doesn't come in. So not only that are you not making any money from that patient not coming in, you have to pay all those expenses. Okay, so ways to help public oral health. So you don't have to work in a public dental clinic. You can help in other ways. tap water and advocating for people to have fluoride in the water. You can even do things like advocating for things affecting social determinants of health, like that there's food security, housing security, cheaper rent, so that people can take care of their other more in-demand needs first, and then that way they have the time to think about their oral health. You can work and volunteer in underserved areas. Sorry about that. You can help out with free dental days. You can, at your school, you can advocate to improve the York Student Dental Program. Like, okay, it's only $600, that doesn't cover a lot. How about we increase it? How about we actually promote it? Because a lot of people have the dental program, they're not even using it. So there are so many ways you can help. Also, telling people about government dental programs. There's so many parents that don't know about this program, Canada Dental Benefits, and they could be getting $650 for their kids. They're paying out of pocket, and they could get reimbursed. And I told you at the beginning that one of the biggest accomplishment in my career was advocating for community water fluoridation. Does anyone know why there's a debate over water fluoridation? Yes?
What I know is that some people say, well, will the fluorides actually act on the teeth and feed there for a while?
Okay.
And you drink the water, you swirl it.
Okay.
I think that might be one part.
Okay, good. That's very good. So you're saying things like, well, water, you're drinking it, the fluoride's not in your teeth for very long.
But
Yeah, so very good. Yeah, that is a good point. Yes.
I worked in a research lab and we looked at fluoride effects on prenatal
Yeah.
pregnant ladies and also their the neurobiology of their
Yes.
kids, and it could affect the
Yeah.
I didn't say it long enough in the
Yeah.
because I graduated, of course, but we looked at that, so that's also possible that
Okay.
it could affect the prenatal brains.
Okay. Very good. Yeah. So the concern is, if pregnant women are drinking it, is it going to affect their fetus?
Yes.
Yeah.
It could also be that people aren't drinking tap water as much, but rather using it for dishes.
Yeah, that's true. They're not even
I
drinking
think
it.
a lot of people just do bottled water instead.
Yeah, that's very good. All good points. So the reason why we add fluoride to the water is because it prevents tooth decay. And lots of research for that, like community water fluoridation's been around for 75 years. It has been proven to fight tooth decay. And a lot of good concerns. Other concerns are it affects the rest of your health, like maybe it causes bone cancer, maybe it causes thyroid problems. People are worried, okay, why are we adding a chemical to our water? That's not natural. Or the cost they're concerned about, where the fluoride's coming from, is it a natural source? And also, if the fluoride's too high, then people get these white spots on their teeth called fluorosis. And a big one is choice. Especially now, at the end of COVID, people are so upset with the fact that there are all these mandates that they're like, no, we're gonna choose, the government's not gonna tell us what we can put in our bodies, so choice is a big concern as well. However, if we look at the evidence, we're an evidence-based society, and it has shown that fluoride is actually beneficial. When you look at all the research, actually things that the research that shows that fluoride is bad for our health, all that research can be discounted. There hasn't been any proof of that. So the medical officers of health, all of the national organizations all over the World Health Organization says that fluoride is safe and effective, but it has to be at a certain concentration, because if it's too high, it is going to be detrimental. The fluoride makes your teeth stronger. It actually can stop a cavity. So if you have a small cavity starting on the chewing surface of your tooth, on the top surface of your tooth called the enamel, if you have fluoride incorporated into it, it can actually stop the cavity from growing, and actually can remineralize it and build the enamel back up. So fluoride has a superpower that way. Yes?
Can dentists use this to stop the cavities from growing?
Yes. So we have community water fluoridation. So you need fluoride from multiple sources in order for it to work. So you need it from the water, you need it from the toothpaste, you get it from food, green tea, you get it in the dental office from fluoride varnish, you get it from mouth rinses. So you need it from multiple sources, because as you can see, even though we brush with toothpaste, we're still getting a lot of cavities. So the more fluoride that you have, the less cavities you have. cheap, it reduces decay. It does work best on children because before their adult teeth forms, if they're drinking fluoridated water, it gets incorporated into their brand new teeth. So when their teeth erupt, they're already resistant to cavities. And it is true that when you drink water, it's not in your teeth for very long, but the thing is you're also digesting it and it's being secreted back into your saliva. So then the saliva will help coat your teeth with fluoride. So it does help children more than it does adults, but the good thing is it's helping everyone because it's in everyone's water no matter what their income is. So pregnant women can drink fluoridated water. So for every dollar spent on community water fluoridation, it saves $43 in dental care. So huge cost savings to our healthcare budget as well. And it's endorsed by several organizations. And right now in Canada, about 2/3 of the population has fluoride in the water. The other third, it's usually because they live in rural areas, so they have like water wells. They're not on city water, so that's why they don't have it. So this is dental fluorosis. So this is dental fluorosis. So if someone actually swallows toothpaste when they're young, like between the ages of like 0 to 3, if they're swallowing the toothpaste instead of spitting it out, they'll get these little white spots on their adult teeth when they erupt at age 7. So with young kids, you have to supervise them when they brush because oftentimes they're swallowing instead of spitting. They're not good at spitting. So the parents have to put just a little bit of toothpaste on the brush the size of a green pea and not use toothpaste with fluoride until they're 3. And then you can avoid this. Also, the fluoride in our water used to be twice as high as it was before. And then when we started seeing all these white spots, we're like, uh-oh, we added too much fluoride to the water. So now they dipped it down to like 0.7 parts per million. Now we're not seeing this anymore, unless they're swallowing the toothpaste. This is severe. So people, when you see this, it's most likely because they grew up in an area that naturally has high levels of fluoride in the water. So actually all water, like all oceans, seas, lakes, all have fluoride naturally. Because fluoride comes from a sediment off the rocks. So all water naturally has fluoride. In a place like Stratford, Ontario, they actually have way too much fluoride naturally in their water, and the government removes it down to the 0.7. There are some countries like in India that have like 7 times the amount of fluoride that they should. So the kids end up with like brown spots on the teeth because they naturally have too much fluoride in the water. So that's when they have to actually drink bottled water or have the government remove the fluoride in the water. So fluoride is natural. So it's true what you said, a lot of people are drinking bottled water. Bottled water has extremely low amount of fluoride in it. So you actually should be drinking tap water. If you're in Toronto, because the tap water in Toronto has fluoride, so it helps your teeth. And yeah, you're right, like most of the water we're bathing in it, cleaning our dishes with it, but we're also drinking it. So it doesn't harm our dishes and our showers and our bathtubs, but it benefits our teeth. So now you don't have to worry about the fluoride in the water in Toronto causing this, because the concentration is too low to cause this. Yeah?
Question, is fluorosis reversible?
No. So once you have this, the only thing the dentist can do is put veneers, like even this. So this is an easier fix because we can do tooth whitening. The white spots will remain white, the rest of the teeth will turn white, and then you can match. So now the whole tooth is white. So this is easy to fix. Okay, so all the ways we can get fluoride. So say someone is on well water or doesn't want to drink fluoridated tap water, that's fine. You can get fluoride from mouthwashes, toothpaste. You can get it in office at the dentist with fluoride varnish, or that special medicine called silver diamine fluoride can be painted on areas where the cavities are starting. And it's naturally found in food and drink. Anything made with water, because water has fluoride, will have fluoride. Okay, so fluoride's a good thing, water's the best thing for our mouth. So for advocacy, what we can do is advocate for clean water, advocate for food security, housing security, income for a higher minimum wage. We should advocate for sugar reduction and taxing sugary products, or having sugar labels right on the top of the product saying how many spoons of sugar are in it. We can advocate for childcare benefits, because if parents can afford childcare, they'll be able to work and make more money, and then they can afford dental care, afford fresh food. And we should advocate for health benefits for all workers, because as you know, when someone has dental benefits, they're more likely to go to the dentist. So what can you as pre-dental students do? Okay, so you can advocate for government dental programs. You can advocate to promote and expand the coverage for like student dental benefits. You can make sure that there are food banks at your school, and you can do things like donating toothbrushes and toothpaste products to those food banks. You can do oral health presentations to your fellow students. Make sure there's fresh food available. Because I remember, Stormy, you told me that like in the evening times, like a lot of the healthier options aren't even open, and you can only get like fast food, junk food. I mean, the evening is when people need to eat and snack, so the only options are things like candy, which you told us actually causes cavities. Oh my gosh. and so one of the things you can say is, can you make sure there's like healthier food options available at all times, so we don't have to eat candy as a snack. So there are so many things that you are doing already. I'm so impressed that you're doing things like organizing this event, coming out on a Saturday afternoon when you could be studying or doing something fun. But this was fun as well. So I'd like to thank Toronto Tooth, Bright Futures, all the organizers, all of you for coming out today. And not only just today, but what you're doing every single day is your focus on the community, your focus on improving oral health care, decreasing oral health inequities. You're all going to get into dental school, and I'm going to be so impressed with, I'm already so impressed with you, but I'm just thinking like, you were doing things that my colleagues aren't even doing now, and you haven't even like started your profession yet. So like, I am confident that we're not going to see all these oral health inequity problems, all this oral disease in the future, because all of you will be helping to prevent it. So thank you very much for your attention, and you can always contact me. For any of the speakers before we end the presentation? Yes?
So I have lots of questions.
Okay.
And I'm sorry for too much. But so I've been seeing a lot of videos like lately that there are like lots of dentists. They're saying when you do like brush your teeth, don't rinse it.
Oh,
Either,
good
like, keeping
question.
it wet. Yeah, I'm thinking like you said, if you're like swallowing it or
Yeah.
you know that could happen if you're like just
Yeah.
spitting out. I'm thinking like how does that work? Should we do it or not?
Yeah, so very good question. So after you brush your teeth, so you should be brushing your teeth with a toothpaste with fluoride, because fluoride is what's preventing cavities. So you should just spit after you brush. Don't rinse your mouth with water, because if you rinse your mouth with water, then that means that you're rinsing out the fluoride. So spitting is enough. With young kids, like anyone under 3 shouldn't be using fluoride, because that's when their adult teeth are developing and they can get fluorosis. But at this age, like once you're over 3, you can't get fluorosis because all of your teeth have already finished developing.
Oh,
So even for us, if we swallow the toothpaste, you can't get fluorosis.
Yeah.
So don't worry about it. It's only for young kids.
Yeah, and my next question is that I think someone said that there is an emergency dental care
Yes.
in Canada.
Show us that.
But I think there is, because my mom was visiting a few months ago, and then she has this crown. And as she gets here, I don't know how this happens, but she was eating food and this tooth just like, it's like gets broken and she gets it out. And so what I did is to like find an emergency, like just online, I just searched it up, and they were like, you can come in, like in a few hours. And I was such a relief that we could go on the same day and everything.
Yeah.
But the bad thing was that when you go there, they don't have like everything professional. They cannot help you like right there. They could help you a little bit, but not like fully put it back or I don't know everything that needed to be done. But I think that was like such a relief. I didn't know that before that there's like.
And do you remember the name of the clinic that she went to?
So what I did is that there's a dental office called Polar Dentistry or something, and they're like in Yorkdale. They have like other places too, but I called them and they were like, oh, there's an emergency dental clinic, and they gave me the number, but I don't actually remember the number. But I'll search it up.
Because like, oh yeah, go ahead. Because I can do it too.
What time was that? What time did it happen?
Like close to nighttime.
Like 7, 8?
Yeah.
Yeah. I mean, there is no 24-hour emergency services in here.
Oh, this one was.
Like during the night?
Yeah.
After 12?
Yeah, that was like why I was surprised, because everyone says like here you should be very careful, like there's not like dental emergency, and I think there are not a lot, I'm pretty sure, but I think this one was like, and it was very close to me too. It was like in you know where Wilson and Avenue Street, and it was super close, and I was just like wow. And I wasn't expecting this in Canada, cause like back home for us, like I'm Persian, and it's pretty easy going to a dentist and everything. But once I came here, it was just very hard for me to get like an appointment, like if I needed to go like next week or something. And then, yeah, this is another question.
And then did your mom have to pay?
Yeah, she had.
Yeah. So if it's an emergency and it's adult and they can't pay, they can go to my charity, Filling the Gap Dental Outreach that I volunteer with. But if you have to pay, there's only one dental clinic, like Toronto Emergency Services on Yonge Street, like you were saying. But then you have to pay for that. And they just do the emergency care. They might just patch it up and then say you have to go somewhere for, definitive services.
But they helped so much like with the pain and also like what she has to do like after.
Yeah.
So that was very nice. And then I was thinking the next thing was that is it dental clinics are so expensive? Is it because there are not lots of dentists?
No, actually there are a lot of dentists or a lot of dental offices. We have 10,000 dentists in Ontario. So almost every corner there's a dentist. The reason why it's so expensive is because our staff costs are high, the clinic costs are high, the equipment and materials are extremely high. So a typical dental office, their expenses run 70%.
Oh.
Yeah, so it's very expensive to do dentistry here, which is why the costs are high.
And you were saying like private practices are like more expensive in terms of like paying the staff and everything.
Yeah, so at public offices, you don't have to pay to come to my clinic, but you have to be on a government dental program. So it's free for all of my patients, none of my patients pay.
Yeah, that's it. Thank you.
Thank you, those are good questions.
I'm so sorry to interrupt. Is it okay if we just save more questions for the end?
Oh,
We just want to wrap up the live and the presentation straight now. Thank you so much, Dr. Mohanta, Sorme, and Shahzad. I really appreciate you guys coming out today and listening to this presentation and just being a part of this initiative that we have. Thank you so much to Toronto Tooth as well. I did want to give a huge thank you to some of our supporters as well, who are not necessarily represented here today in our audience, but York Orthodontics, Brookdale Dentistry, and Green Dental Care actually helped us assemble the oral health kits that we have here on the side right here. So the mouthwashes, the toothbrushes, the toothpaste, the floss, they're all going to be donated to local community members around York University, and that is a huge reason why we're partnering with Toronto Tooth to do that. They have this experience and we wanted to showcase that with our team. Of course, there's so many initiatives that we want to start as Bright Future Dentists, but we do see that partnering with different people in the field of dentistry is really motivating and is kind of creating that stronger force of drive and power in order for us to make that greater difference. So I wanted to give a huge thank you to them, a huge thank you to our sponsors, because without them we wouldn't have these kits to be able to donate. And I did want to say that all of our attendees, you are encouraged to take tooth products that you need. Your oral health is really important as well. Just by you being here, I know that you care. Whether it's like for pursuing dentistry or just for your own health or your family members, it is really amazing to see this initiative initiative from all of you, and I hope that it continues in many different ways, that you're gonna move on throughout all your paths. I wanted to give a huge thank you on behalf of Bright Future Dentists, myself, Sorma, and Rustine. As the founders, we're so proud of this team that we've created. Over the past 2 years, it's become such a phenomenal change. Being at York, I noticed it wasn't the most pre-dental friendly, and we kind of saw that gap and we wanted to bridge it with many students. And just having the volunteers supporting us along the way is really what made it so phenomenal today. So huge round of applause goes towards our amazing volunteers and our team. And I did want to say that throughout the next semester, we are having more networking events, and we're actually having our DentNet event happening on March 24th, so just stay on the lookout for those posts there. It's not necessarily going to be as educational as today's. It's going to be a really nice, memorable night to network with other pre-dental students, dentists, and as well dentistry students. Because we know firsthand that human connection is the greatest thing to really push you to do not only great things, but push you to become a better person. At least for me, connecting with Sorma and Rustine has been a really motivating factor towards me going towards dentistry. And I know that for many others, us being here for them has really helped them out as well. So with DentNet, we want to kind of collect everybody together to create that power and drive for everyone and just have a really great night out of it. Another huge thank you goes out to Dr. Mohanta for today and just so much knowledge that you shared with us today. It was honestly so amazing to hear all the effort that you put in, not only with your work in public dentistry, but helping pre-dental students is always greatly appreciated.
Thank you.
Yes, of course. And yeah, that's it.